Did you do a banana bread?
I did make banana bread. That's why I put on 3 kilograms, Jessie. I'm not proud to say I put on 3 kilograms in lockdown.
Hey, 3 kilograms is nothing. That's nothing. Are you kidding me? Hi everyone, ahead of World Immunisation Week, I'm meeting an inspiring GP working in our amazing NHS about how the COVID-19 pandemic has affected her life and how she's coping in one of the most challenging years ever. My pleasure to introduce Dr. Farzana Hussain. Whereabouts are you now? Are you at your GP practice right now?
I'm at my practice, Jessie. Yeah, I'm at the Project Surgery. I'm in Newham in East London.
And how has the past year affected your life with this pandemic taking over and being a GP in London?
It has been the busiest year of my life. Been a doctor since 1997, and I think, Jessie, we just had to learn new stuff. It was a new disease, so I was working in the day and then reading new stuff in the evening. We didn't know anything about a new disease. It was like a medical school year, all in one.
We appreciate everything that you have all done in the NHS, but what were some of those challenges that you faced over the last year? Because you were busy, but I can imagine that there was lots going on and it was really restrictive and stressful. And
it was a challenge of making sure that we were still reaching everybody and wanting to keep people safe from COVID, because 1 in 3 of us obviously don't show any symptoms. So understanding why we weren't seeing people face to face, but making sure we were still reaching them. Suddenly I can see our childhood immunization rates going down, and I'm thinking, oh my gosh, we're going to get another measles resurgence. South London has already had one in the last few years, and I could understand why parents wouldn't want to bring tiny little ones into what they deemed was a possibly COVID-ridden surgery. We were vaccinating children in our front garden because we knew there was more ventilation and we knew that it would be less time. And I said to our dad, I know it was April this time last year, and I said, I know it's windy and little one's only 2 months old, and I said, I'm sorry, we're just all learning. And he just looked at me and said, don't worry, we're all learning. And the trust that he put in me, it was a privilege, actually.
Did you see the rates go up of people coming to get the vaccinations for their children?
Definitely. We know, don't we, that we need about 92%, so just more than 9 out of our 10 children immunized. We know that then that protects us all, and our rates had fallen to about 60%, Jessie, right. That it had gone that far down, and within 3 months we managed to go back up to not 92%, but we managed to go up to 80%.
Why is the COVID-19 vaccine so important to you on a personal level and a professional level?
Well, I think, Jessie, for me, it's really as simple as it is the only thing that we have that is going to save lives. We do know that just me taking it or just Jessie taking it isn't protecting us all. That's not how vaccination protection works, is it? We need, 90% of us to be taking it so we're all protected. Like many parts of the country, we've been vaccinating from mosques, from gurdwaras, churches, community centres, but we have got some work to do because we've got 74% BAME in Newham, we've got high poverty levels, and we know that vaccination rates are a little bit lower in people who are more financially deprived and in different BAME communities, and lots of myths going around. So I'm trying to do a little bit of work around that just to dispel myths, just trying to give the message that having an injection during Ramadan doesn't break your fast. It's not considered nutrition. So just so that we can keep it up and we can protect people as soon as possible, because sadly the COVID rates have gone down because of lockdown, but COVID hasn't gone away, sadly.
No.
It's very much here.
Have you been vaccinated?
I have. As soon as I was invited, to be honest, I was there at 7 o'clock in the evening. I had both my doses, and I was so keen to have it as soon as my turn came, because we did the over 80s first, and as soon as my turn came, I wanted it. And it's exactly that, Jessie. I want to be alive for my children.
What are you looking forward to most once you and your loved ones receive the vaccination?
I'm looking forward to seeing a smile in a room rather than across video. Just being able to have a coffee with someone again.
I know. Are your family vaccinated yet?
My dad is a retired anaesthetist. He lives up in Lancashire, 200 odd miles from me. He's 79 and he's just had his second dose last week. So I'm really pleased about that. And obviously I haven't seen him in well over a year.
Do you think you will approach work differently after this hopefully all calms down and goes away and we're all vaccinated?
I mean, I feel I'm here to provide healthcare. I'm not here to tell everybody what to do. It's really partnership. It's about me being a vehicle to help people live healthier lives. I'm here to serve them. And I hope that that continues, and continue to be kind. I think it's the kindness and the giggles that has got me through. People saying outright, or I'm a big Twitter fan, and just people putting what they made for dinner on Twitter. It's just made me feel like we're still connected.
Did you do a banana bread?
I did make banana bread. That's why I put on 3 kilograms, Jessie. I'm not proud to say I put on 3 kilograms in lockdown.
3 kilograms is nothing. That's nothing. Are you kidding me? I did the sourdough starter, I did the banana bread, I did it all, and I ate it all. I think you deserve, once this is all over, please, I think you deserve more banana bread, a massive holiday, and a huge hug with your father. And thank you on behalf of all of us. Thank you so much for everything that you do every day. Particularly over the last year, how you've thought on your feet, how you've tried to just help your community and spread the word about getting vaccinated. So on behalf of me and UNICEF and everybody, thank you so much for speaking to us today, Dr. Hussain.
Thank you, it's been my pleasure. Thank you.
Thank you. I feel very privileged and honoured to have spoken to GP Dr. Farzana Hussain there, talking about how important vaccinating is, especially right now. If you'd like to support UNICEF's role in the COVID-19 vaccine rollout, you can give the world a shot by donating at vaccinated.org or signing our petition to share the UK's surplus of vaccines. Thank you so much for joining us today. Take care.